In Ontario, they've made some extremely troubling observations.
They were horrific. It's shocking that this can happen here in Canada.
I had obviously a range of emotions of anger, of sadness, of frustration.
And reading those reports was the hardest thing I've done as Premier.
This is a situation that has gone on for a long time. We need to take action as a country.
I take full accountability for the system that we inherited. But I can tell you, I'm going to fix this system.
Hi there and welcome to Power and Politics. I'm Vashi Kapelos. Members of the military sound an alarm on the incredibly disturbing scenes they're witnessing in long-term care homes in Ontario. Severe neglect, appalling conditions, aggressive behavior, just some of the accusations they've lodged at 5 facilities where the Armed Forces is deployed to help manage the COVID-19 pandemic. Ontario Premier Doug Ford is vowing justice and accountability after reading and publicly releasing the military's report, but he stopped short of announcing a full public inquiry. The CBC's Ellen Morrow has been following the story. She joins us with more details. A warning to everyone watching, those details are very disturbing. Hey, Ellen, thanks for being with us. Take us through the highlights, what we need to know out of this report.
Well, Vashi, this report is incredibly disturbing reading. It sort of gives you a bit of a punch in the gut as you go through it, as you go through how the military is describing what's really a grim reality, according to this report, at these 5 long-term care homes across the province. And the allegations in this report, as I say, are incredibly disturbing and really run the whole gamut. There are allegations of residents being left in soiled diapers in their rooms, not being fed regularly, of there being cockroaches and flies and other insect infestations in some of these facilities, of medical equipment being reused between multiple patients without being sterilized. In one of the homes, the behavior towards residents was described as abusive and inappropriate, and that degrading comments were being made toward residents in that home. At another facility, this report describes a choking death, saying that staff were not putting residents in the upright position to be fed, and therefore this particular resident was being fed while they were lying back and subsequently choked to death. So again, a series of really disturbing allegations in this report. I spoke earlier today to a woman named Sherry Zelensky. Her mother is named Margaret Simpson. She lives at Orchard Villa, one of these homes just outside of Toronto. She hadn't yet seen this report when I spoke to her. I went through some of the allegations happening at the particular home where her mother is, and this family is obviously devastated by what's happening, but Sherry Zelensky says they can't really afford to be devastated right now because they need all their energy to keep fighting for her mother. Here's a bit of what she had to say.
When you know something isn't right and there's nothing you can do and you can't walk through that door, it's disturbing to say the least. It's nothing I would ever imagine would have happened in Canada. This is something that you wouldn't even treat your worst enemy or an animal. Anybody should not be treated like this in this country. And to think that she's been going through this, it's hard enough for us watching her go through this, but imagine her living through it. So our family cannot break down. We are here to fight for her. She doesn't have a voice, and we are her only voice.
So as devastated as they are by the findings in today's report, Vashi, the family says they are not surprised. They long feared, they long suspected that there were deficiencies in care going on.
And what about the reaction politically so far from both the province and the federal government?
Well, the province has been criticized throughout this crisis as the death count in long-term care homes has gone up. And we've heard a similar response from the Premier today, as we've heard in past cases where he's been criticized, vowing to really move heaven and earth, in his words, to solve the situation. Here's what he said today.
I inherited this system. The buck stops with me. I take full ownership. But my job is to fix a broken system that's been broken for decades. And I can assure the people of Ontario that I'm going to move heaven and earth to make sure that we leave no stone unturned, and we're going to fix the system. No matter what it takes, no matter what cost it takes, I'm going to make sure we protect the most vulnerable people in these homes.
Now, Ford also said that the buck stops with him, but as you heard in that clip there, Vashi, he's also blaming past governments, describing what he says were decades of neglect. Now, as you also said, the province has stopped short of calling for a public inquiry. Instead, there will be a commission starting in September that will be investigating this. The province's coroner will also be investigating that death outlined in this report. And in terms of the provincial-federal relationship, the Premier today asked for federal help, for funding in helping to fix this crisis. We also heard Justin Trudeau speak about this today as well. He called the report extremely troubling, extremely disturbing. He said the federal government will help Ontario, but what that help will actually look like really remains unclear.
Okay, thanks, Ellen. Really appreciate the update. The CBC's Ellen Morrow for us. We are going to be speaking to family members about this report. One who lost a loved one in one of the homes that the military is right now helping out in, and another one who fears right now for her mom's life because that mom is also in a home that the military is helping out in. First, though, we want to, of course, bring you the political response. We asked to speak to Ontario's Minister of Long-Term Care, Marilee Fullerton, but neither she nor any other representative of the Ontario government was made available. And a member of the federal government, nobody from the federal government is being made available either. We have, however, reached Andrea Horwath. She's the leader of the official opposition NDP in Ontario. She joins us from her Queen's Park office. Hi, Ms. Horwath. Good to see you. Thanks for making time for us.
My pleasure, Vashi. Nice to see you too.
So Ellen just played that clip from the Premier saying he is prepared to move heaven and earth to change the situation. Is that enough?
Well, Vashi, I just want to say it rings a little hollow when the Premier was telling us weeks and weeks and weeks ago that they had everything under control with long-term care. They were telling us that they would spare no money. They wouldn't spare a dime when it came to making sure that everybody had what they needed in long-term care. You remember, he was going to put an iron ring around seniors in long-term care. None of that came to pass. None of that was true. And so here we are with him making more commitments. But at the end of the day, those commitments ring hollow when we don't see the action that actually backs them up.
What specific actions are you looking for? And I take your point, but I would say that, they presented that over the past month. They have been asked a number of questions about the situation in long-term care homes. And they have said, if a home needs money, if it needs to be overtaken by the government or by, someone other than who is running it right now, they're prepared to do that. They've done it in 2 instances. Like, what more specifically do you think they need to do?
Well, for a start, those 5 homes that the Canadian Armed Forces identified with having problems, they should be taken over. There's also a number of homes we know where family members and where frontline workers have been begging the government to step in and take over. That needs to happen. And look, there needs to be some accountability and some taking of responsibility here. I mean, the Premier can say he takes full responsibility. Well, whatever happened to ministerial responsibility? I think Marilee Fullerton needs to lose her job over this. It's just not acceptable what's been happening. And true, it's been happening for many, many decades. But this is a government that in its first budget cut $34 million from long-term care and reduced the number of proactive resident quality inspections down to only 9 when we have well over 600 long-term care homes in our province. So there's definitely a lot of things that need to be done. We need more inspections happening in long-term care. We could be doing that right now. That needs to happen. Instead, we're hearing horrifying stories of workers saying they're calling the Ministry of Labour, the Ministry of Health to get some inspections done because they're worried about their safety and the safety of their residents, and they're not getting the inspections. So there's a lot that can be done right now to try to bring some sense of relief. The people that you're talking to, the family members, just my heart aches for them. I mean, people must be terrified today, wondering about the conditions in the homes that their loved ones are in. And it should never have gotten to this, Vashi. I agree, it should never have gotten to this, but it is where it is. And the government needs to take much more proactive steps as opposed to just, coming out with these phrases that Mr. Ford comes out with. It's just not good enough.
I wonder when it comes to, I mean, these are 5 homes the military is in that they have identified very severe issues in. But I think a lot of people, at least I've heard from a lot of people who have family members in homes that are not, that don't have the military working in them right now. And they're also worried about what if it's like that there, what might it be here? When you talk about inspections, is that specifically what you're looking for? Do you want those more random inspections of other homes? Should we be trying to figure out exactly how widespread the problem is? And I don't want to paint every home with the same brush, not at all, but should we be trying to figure that out?
Oh, absolutely. And there has been a problem with long-term care for a very long time. We know that in many homes, we have the workers that, as you know, are working 2 and 3 jobs. And so they're not able to provide the kind of quality and hands-on care that we want our loved ones to have. We know that there's corners cut, particularly in for-profit homes. Corners are cut on food, they're cut on staffing, and they're cut because if you can save a dime, that dime goes into the profit margin. That dime goes into the shareholders' return on investment. So we have to look at that too. We need that full, transparent public inquiry to take place, but it has to be a find and fix inquiry so that as we uncover these issues, we solve them right away and we don't let them continue for years to come. There needs to be much, much more transparency. The government needs to be much more forthright. I mean, even in this situation with this listing that the armed forces did of the horrors, the government's saying they're going to do an internal investigation. Again, not transparent, not public. Nobody knows what's really going to be said or done, and that's not good enough.
They did release the content of this report pretty soon after receiving it, though, and made it completely public. They are saying that they will launch a commission. I know, they are promising an investigation, and the results of that will be made public. Why is that not transparent enough?
Well, my understanding is, Vashi, that the only reason that this got released today is because a media source got a hold of it. And the government got the heads up that it was going to be released by the media if they didn't deal with it. So again, this is another indicator of why I have worries about transparency. And no, a commission is not good enough. A commission that's scoped by the government, that they get to appoint the commissioner who then can cull the voices of who is going to be heard and not heard. Any of that evidence will be done in the back rooms and not provided in a public way. People deserve so much better than that. And in the kind of wake of this damning report, surely the government can see that it needs to be a full, independent public inquiry.
As far as fixing the issue immediately, we heard the federal government today say we will be there for Ontario. I've spoken to other former health ministers in other provinces outside Ontario who say if you want to expect the same level of health care in a long-term care facility as you do in a hospital, it's going to require a lot more money. Do you think the federal government needs to immediately increase health transfers to Ontario?
I would say we need to wait to get the profits out of long-term care before we start putting more money into the pockets of private corporations. That's what I would say. But do we need to have adequate levels of funding? Yes. Do we need to have a regime of accountability, transparency, a public delivery, as we do the same kind of regime as we have in acute care in hospitals, as we have in, should we have that in long-term care? Absolutely. But I would say that the private ownership and the reaping of profits off of long-term care needs to be front and center in this public inquiry.
Public homes are not free of issues, though, and other experts I've spoken with have said the data is not necessarily complete in order to conclude this is only a problem because of the fact that private companies run some of these homes. And in fact, even in the public delivery of healthcare, there are lots of issues in hospitals, for example. How will that, be enough, I guess, to really, truly address the true nature of the problem?
Well, I'm not saying that's the only thing that needs to be done. But what I am saying is, why is our public health money, why are our public health dollars, or just our public dollars, period, going into the private profit margins of companies? It shouldn't be happening. Every single public dime that goes into long-term care should be utilized to make life decent, have decent quality of life, decent quality of care, decent supports for our seniors. And when you have in Ontario so far twice the rate, as in not-for-profits in outbreaks, you have twice the rate in the private sector. You have 4 times the rate as what happens in public long-term care facilities in the private sector, then there's, where there's smoke, there's fire, Vashi, and we can't pretend that that's not the case. Yes, there are many, many issues around funding, around staffing ratios, around hours of hands-on care for every resident. There are all kinds of pieces that we need to address. The wage rate of these people that we call heroes now, but for decades they haven't been treated like heroes. In fact, their wages got capped at a 1% increase, and their minimum wage increase never occurred. This is all under the current Ford government. So there's a lot of things that need to change in long-term care. I'm not saying that the panacea is getting the profits out, but it's one thing that has to happen so that we can ensure that there is never a decision about not, getting new equipment or not allowing folks. That report said that staff were afraid to use PPE because they would get in trouble from the employer. They were afraid to do things properly because they didn't want to get chastised or in some way have retaliation from the employer. That should never be happening. It should always be about what those workers need to do their job properly, and importantly, what the residents need to have a decent, secure quality of life so that they and their loved ones can have peace of mind and dignity in their last years.
Okay, I'll leave it there. Thanks, Ms. Horvath. Appreciate your time as always.
My pleasure, Bassy.
A troubling report, to put it mildly, out today from the Canadian Armed Forces is bringing to light serious problems in 5 Ontario long-term care homes. At one facility alone, CAF members say they observe COVID-19 positive patients wandering unisolated. There wasn't even enough personal protective equipment. Staff reportedly reused supplies on patients, such as catheters, and patients were given expired medication as well. Here's Premier Doug Ford reacting to what he heard.
But it's unacceptable. I think it's appalling. I think it's disgusting what has happened. Just the dignity of these patients in long-term care not being cleaned. These are just standard operating procedures to clean someone. When you feed them, you lift them up. I'm not an expert in health, but I know when you feed someone, you lift them up and feed them. It's so disturbing when I read this. It was hard to get through. It was the worst report, most heart-wrenching report I have ever read in my entire life.
We now want to hear from people directly impacted by the report. Jacqueline Mitchell joins us from Sudbury, Ontario. Her mom has Alzheimer's and lives in the Eatonville Care Centre in Etobicoke in Ontario, one of the facilities where military members are deployed. Hi, Jacqueline. Thanks very much for making time for us.
Hi, thank you very much.
What was your initial reaction when you saw parts of this report?
I was ashamed for the province. I was not surprised, however. It is deeply shameful to listen to what we all had to listen to as a nation today.
Why weren't you surprised?
That was my response.
Sorry.
Because my mom is there.
Yeah.
Because COVID hit us, like we've been in reaction mode since COVID hit us. And the province, it took the military, 30 days to figure this out? We should have started this process since the first death was reported in a long-term care facility in Ontario. For me, I knew this was shocking when Eatonville called me and said 14 people had died. Mm-hmm. That was the time for the province to step in because something was wrong.
What has your mom's experience during this been like?
My mom has Alzheimer's, so she's not able to communicate verbally. My mom can smile if she sees us. My mom can perhaps recognize my voice, but my mom, for all intents and purposes, is not verbal. So we just have to hope that she is being well taken care of. Now, we do have a camera in the room, which we monitor and which we're able to see what's happening and, pick up the phone and call for some kind of follow-up action. But we see the lack of changing. We've seen everything that's in that report. We haven't seen the rotten food, but we've seen the actions. such as lack of changing. My mother has not been moved from that bed since March the 9th, as far as I know. She's been lifted up and down in a one of those beds that can lift up and down, but her position has not been changed.
And how is it for you to, I mean, I can only imagine, but how is it for you? I know you're seeing it in print now, but you've lived it with your mom.
Yes. So when I hear the Premier say it's unacceptable, I could have told him that, like a month ago. When he says it's undignified, I knew that a month ago. And you know what? It continues to be undignified, which I'm not hearing about, is I want to see and I want to hear an immediate action plan. Sort of like, let's triage this problem. Mm-hmm. I do not want to know what you're going to do next year with a commission of inquiry. That would be great. That would be good. But that's too far in the future. I want to know now how you're going to keep my mother COVID-free. I want to know how this home is going to operate if we have a second wave, which everybody is calling for. What new processes are we going to take now to keep the people who are COVID-free, COVID-free? My mother is still in a home that is full of COVID people. That is disturbing. That is gut-wrenching for me. Not reading a report. It's gut-wrenching for me. Every day I can't hug my mother. It is 77 days since I've seen my mother. That is gut-wrenching. I live it. My mother is not a statistic. My mother is a human being who has not been able to communicate with her children. That is why I want to see some sort of triage of an immediate problem. How are we going to fix this? How are we going to keep them safe? How are we going to separate them? How are we going to ensure that these people who have been fortunate enough to not get the virus, that they stay that way?
What's your mom's name?
And my mom's name is Jacqueline Mitchell.
Lena?
Yes.
And you heard, I mean, I see that you've heard everything that the Premier said today, and you're not the only one expressing frustration that there isn't a more immediate action plan. I guess for those members of the government that are watching both from the provincial level and the federal level tonight, what's your message to them right now?
My message is, I don't want to hear when I can get my hair cut. I want to know what phase my mother is in for this reopening of this country so that I can go and see her. I do not want to go and eat in a restaurant. And by the way, if a restaurant had the conditions that was described in those reports, in that report, they would shut the thing down. They will not let the public go and eat in those places. My mother is living in it. That's what I would say to them. Shut them down. Take them over. Do it now. Do not have one more person dying or getting COVID in those homes. Let's act today. Like, these people are still living in those conditions. We are appalled at Bell Trinity Park and what people did in Ontario, in Toronto. My mother is in Bell Trinity Park every day. She cannot leave, and I can't go and see her. She is on a cruise ship. It's a nightmare. She's never coming off.
Well, I really appreciate you sharing your time with us tonight and this really important message. I can't imagine what you and your family are going through. And I really do appreciate it, genuinely.
Thank you. Thank you very much.
I wish your mom the best. Thanks, Jacqueline.
Thank you. Thank you.
That's
Bye-bye.
Jacqueline Mitchell. Her mother, Lena, has Alzheimer's. She lives in the Eatonville Care Center in Etobicoke. That's one of 5 facilities where the military is deployed in Ontario. I want to recount for you now a little bit of what that report that Jacqueline was reacting to said. In at least one home, the military found residents who tested positive for COVID-19 were not isolated. They were allowed to wander the facility. In other cases, staff were seen not changing PPE, personal protective equipment, for several hours while treating multiple patients. Syringes were also reused sometimes. Also witnessed by the military, significant fecal contamination, bug infestation, residents not bathed for weeks, residents crying out for help, sometimes for more than 2 hours. On numerous occasions, CAF members say staff behaved aggressively towards residents, like forceful feeding and degrading comments. The report says there was a culture of fear to use supplies because of the cost of those supplies. In some cases, expired medication was used on patients. Now, the Premier and the federal government, the Prime Minister, responded today. Nobody from either government has been made available for an interview on this show this evening. They have all expressed their frustration. The federal government said, we will be there for Ontario, though no specifics as of yet have been provided as to how that will happen. In both Ontario and Quebec, the provincial governments have asked for a 30-day extension of the military in the homes, the long-term care homes they're in right now. The federal government is right now, considering that request. We're back in a moment here on Power and Politics. I'm Vashi Capellos. Hi there, I'm Vashi Capellos. This is Power and Politics on CBC News Network. We're coming to you on a live stream on the CBC News app as well as CBCNews.ca. You can access us anywhere in the world via those websites. I'd like to welcome viewers joining us on their local stations in the Maritime provinces. Good to have you with us on this Tuesday. We're reporting on the shocking report on Ontario's long-term care homes, which is raising bigger questions about how seniors are treated in this country. Among the shocking revelations from the report were incidents of residents waiting for hours after calling for help or while calling for help, being fed in a way that caused them to choke, and staff were using medical devices without disinfecting them. So who's responsible and where do we go from here? Jane Philpott is the former federal health minister for the Liberals. Hi, Dr. Philpott. Good to see you as always.
Thanks, Vashi.
Thanks very much for making time for us. I read your tweet a few hours ago when this first came out, and the first thing you wrote was, "This is on all of us." What was your initial reaction, and what do you mean by that?
Well, I think the reason that I wrote that is because we're all devastated by this report. It's absolutely horrific. I've just read the full report myself, and I'm still stunned by what I read. But, you know, the first thing that seems to happen is everyone goes about trying to figure out whose fault it is and who they can blame and how many years or decades has this been in the making. And we've got to stop focusing on who we're going to blame and say, we all had a part in this. I mean, we all elected the governments that are leading us. Those governments have in turn had responsibility over years or decades to try to fix the kinds of failures that we have known exist in long-term care facilities. But it's more than that, right? It's the entire health system. It's hospitals and doctors and others who have always known that there was this whole separate area of healthcare in a way that stood outside of the rest of the system, and that somehow we didn't feel responsible for making sure that it had the same quality of care that we would expect in a hospital. And I think about the shareholders of the private companies that run these places, and they're complicit too, because somebody's made money in places where people have been cared for or not cared for, as the case may be, with lying in their soiled briefs for hours on end and calling out for help and surrounded by cockroaches and other infestations. I mean, the report is like something out of a horror film, and it's happened on our watch, all of us.
Do you, when you read through the details, because I think what I'm getting from what you said, and I think I had a similar reaction in that you think about the issue as a whole, and we've talked about it a lot, but when you read through that report, the specifics that were observed by the military members are sort of stop you in your tracks.
They do stop you in your tracks. And I mean, I've seen some really awful things in more than 30 years in medicine, and I've worked in some pretty horrific conditions. But the kinds of things that elderly Canadians have been living and enduring, kind of hidden away in the shadows. And there have been official reports about this, auditors general that have reported about this. I have no doubt there have been many family members and caregivers and health workers that have tried to blow the whistle on what's taking place. And this is, of course, not taking place in every long-term care facility in the country, but obviously in several of them. And it's now incumbent upon everybody to not act just in the long term with inquiries and recommendations and all that, but the folks who wrote this report said that it requires immediate changes in daily operations. And that's what we all have to focus on right now. Immediate changes, lives are at stake right now, and people are being cared for in these kind of conditions as you and I speak.
Are there immediate changes from your point of view that can be invoked, or things that the government can do immediately that you think would make a tangible difference?
I believe that there are. Very recently in Ontario, I'm aware of the fact, for example, that a couple of long-term care facilities have essentially had their operations taken over by local hospitals. I think kind of the way that is spoken of can sort of make it feel like it's punitive. And I often think about not only the caregivers who are trying to do their best in these circumstances, but also the family members who have put their loved ones in these kinds of facilities. So, it has to be done in a respectful way. But when there are hospitals that are nearby and they've got empty beds and they've got the very best top quality care and infection prevention measures that they understand and PPE that is good quality material, we need to share that out and essentially adopt the long-term care system into the rest of the healthcare system, at least for the short term, and consider going down the road how we're going to do better, because COVID is still alive and spreading within these facilities, and 6,500 people have already died. So we can't wait until there is a national inquiry, even though there needs to be one in the long run. So you do think there needs to be a formal national inquiry eventually? Well, I'll be shocked if the two provinces who are worst affected, that being both Ontario and Quebec, I'd be shocked if they don't call a public inquiry into something like this. You don't have a condition that causes the death of thousands of your own citizens without doing a proper analysis. And, obviously that's the thoughtful process that will ensure that the systemic change happens. It would seem fair to me that the federal government should consider expanding that to nationally, because I think one of the solutions that people speak of is setting national standards. Hospitals have standards by which they're accredited. They are regularly undergoing an audit of their systems to ensure that the best quality of care is being delivered. And it sure wouldn't take much for us to agree to what those kinds of national standards ought to be in long-term care facilities, which, as I say, whether we like it or not, they are part of our health systems and therefore need to be treated as such. I've spoken to some former provincial health ministers who have talked about the extra money. And I know that this is, again, not necessarily the acute discussion, but one that will follow. That money is an issue if you're trying to increase the standard of care in long-term care homes so that it is similar to what we expect in hospitals. Do you anticipate there will have to be, and I know this is always a discussion between provinces and the federal government, but that the healthcare transfers will have to increase in order to specifically address the situation in the long-term care system? Yes, money always has to be part of the solution for a number of reasons. One, of course, is that's in the rest of the healthcare system, that's how we tie certain standards or principles to the kind of care delivery. And there always has to be a reason to sort of say, if you don't deliver care in this format or according to these principles, the transfer will be withheld. And so that we know over time that that's an effective mechanism to be able to maintain national standards. But we're also, we're not talking an exorbitant amount of money here. When you look at the kinds of things that we're spending money on, both broadly as a society now, but even within the healthcare system writ large, in the case of long-term care facilities, it's largely wages. It's making sure that there are an adequate number of registered health professionals, nurses in particular, as well as personal support workers or other types of caregivers who can make sure that they provide the care. That adds up over time, but surely our elderly in society are worth that investment. And before I let you go, Dr. Philpott, you had mentioned some of the concerns for privately run homes. There's, of course, for our viewers, a mix, depending on the province you're in, but a mix of some homes which are run by private companies and others that are run by the public system. Do you think that part of the problem is the sort of private nature of some of the business? Do you think that model needs to change? I'm not sure that we know that entirely for sure, and I want to be careful that I don't assume what a proper full evidence analysis would tell us. But certainly in Ontario, data is suggesting that that's part of the issue. I know that there are private facilities that have not had the same kinds of challenges over time, but where there is a profit motive, there is always going to be a risk of cutting back on some of these things, like the amount of staffing in a facility that's there. And so that can be compensated for to a certain extent by making sure that the standards and regulations are there, but those regulations have to be adhered to. There has to be a proper mechanism for withholding either funding or withholding accreditation or whatever the tool one will use to be able to uphold facilities to those kinds of standards. But it's, as I say, something that has to be addressed very seriously, and it has to be done before any further delay and unnecessary death.
Okay, I'll leave it there. Thanks as always for your time, Dr. Philpott. Really appreciate it.
Thank you for discussing this important issue.
And I promise you, my commitment to the people of Ontario is that I will get those answers. There'll be accountability. There'll be justice for these residents and their families. I take full accountability for the system that we inherited. But I can tell you, I'm going to fix this system. I'm going to fix this system no matter what it takes. But you're right, the buck stops with me, and I take ownership. I take full ownership of this.
At a minimum, he has no choice but to immediately require the resignation of Mary Fullerton, the Minister of Long-Term Care. The buck does stop with Mr. Ford.
Ontario, Premier Doug Ford insists he will get justice for the families of long-term care home residents. A damning report details observations by the Canadian Armed Forces members working in those homes. Residents who were force-fed, unchanged, not bathed for weeks. Staff that is improperly trained. Some were using personal protective equipment with different patients. Ontario's NDP opposition leader, Andrea Horwath, as you heard there, says the Minister of Long-Term Care, Mary Fullerton, has to be removed. Do the allegations require resignations, and what exactly will it take for governments on all levels to ensure long-standing issues in seniors' homes are resolved? Let's bring in the Power Panel in Vancouver. Former Conservative Cabinet Minister Stockwell Day joins us. Supriya Dwivedi, host of the morning show Global News Radio 640 Toronto, joins us from that city. And over in Gatineau, political commentator and former NDP MP Françoise Boivin. Hello to all three of you. Nice to see you. Françoise, I want to start with you on that first question about the NDP's calls provincially for the long-term care minister, Mary Fullerton, to resign. What is your initial reaction?
My initial reaction is always I'm not a strong believer of those big grandstanding moments of asking for the resignation of somebody at this specific time, for the sole reason that we've heard the same thing in Quebec about Marguerite Blais, who's the seniors minister, and they were asking for her resignation and blaming her for her time when she was there as a Liberal. Now she's there with La CAQ. It's not resolving anything. I much prefer hearing the Premier, and I wish I had heard the same thing from my Prime Minister saying, we are all responsible. This is a dark day for every Canadian, us included, and I include all of us collectively as a society, because right now, it came out from the military for going to five long-term care facilities. They haven't been to everyone. We've got the same problem in Quebec. Today, it's air conditioning, a huge problem for the seniors, the conditions we're leaving them in. So, and I've heard these years after year after year. We elect those government, or we don't vote at all, and we don't go voting. So in a sense, we're all a bit complicit. I don't know how you say this in English.
Complicit.
But collectively a bit guilty of it. Now, because of the pandemic, we're all very oriented toward health. It should always be our number one priority. And I think we have to fix the problem, stop grandstanding or make it a political, it's your fault, no, it's your fault, and find solution and fast.
Stockwell, we just interviewed somebody, her name was Jacqueline Mitchell, and her mom is in one of these homes. And I found her really compelling, and especially her insistence that, you know, all the talk of stuff that will be important later on, like an inquiry or like a commission, whatever it ends up being, is not going to help the situation for her mom right now. And I'm wondering what your view on the pressure that the government faces right now to figure out something that will help immediately or that will make a difference immediately.
Yeah, that was pretty heart-touching testimony we heard there, and I would tend to agree. Something needs to be done now. You know, full so-called commissions of inquiry, they generally wage on for years, and by the time there's a problem solved, the problem's either gone away or all the people have died. So I appreciate more the direct approach that Premier Ford is saying he's going to take, and it needs to be done. I mean, if the military can go in there and within 30 days, and bless their hearts for spotting all that stuff, they can zero in on all these issues. You can move people in there quickly. If charges need to be laid, then so be it, if anybody's not living up to the standards. So that's the first thing, move with expediency. The second thing is we hear the alarming rate of people who have died of COVID in the facilities. That's pretty well the case, or not just around the country, but around the world. And here's the concern I have there, Vashi. For instance, the state of New York or New York City, the state of New York generally, thousands and thousands of people dying in the homes because now apparently the governor there is facing legal charges or challenges in court because he ordered people, seniors with COVID, back into the homes. And here's where our governments are vulnerable, because they're keeping our seniors vulnerable, because not one premier has come forward with a plan to designate standalone treatment centers for people who contract this virus or another one or a rebound, as will probably happen. None of them have that in their plans. So absolutely, let's see what's going on in these facilities and fix them. But I'm telling you that premiers are subject, and their governments, to legal challenges, because we know we have to protect the infected, we have to protect hospitals, and we have to allow healthy people to work. And if you don't have standalone treatment centers to care for those who are infected, I believe you're liable, not just legally, but morally.
Supriya, what is your, I guess, take on what Canadians need to see right now, and particularly those who have loved ones in these homes, from the government?
From the provincial government here?
Let's start with the provincial. Yeah, start with the provincial, but you can weigh in on the federal too.
Well, I think, you know, to Stockwell's point about all premiers sort of being in similar boats here, I don't know if that's necessarily true. I mean, Quebec and Ontario have fared much worse than a lot of the other provinces. And yeah, you know, part of that is our populations are just simply larger. But I think if you look at a lot of what British Columbia did earlier on, you know, limiting the number of personal support workers that from going from home to home, and other, you know, small actions like the province taking over certain homes as well, I think the proof is sort of in the pudding. I mean, their numbers are better than Ontario's. And I can certainly appreciate the anger that the Premier expressed today. I mean, quite frankly, he wouldn't be human if he didn't express that level of anger. But he can't really claim that he's shocked at any of this. There have been multiple warnings. This is a failure, as Dr. Philpott noted, of, you know, successive governments of every stripe, really, in this province. And the reality is that whenever it came to, you know, cutting here or there, or not putting the amount of resources that we needed to, it was LTCs that got the brunt of it. And CBC News did an investigation earlier in the pandemic to look at the amount of comprehensive investigations that have gone into these LTCs. And, you know, in the last 2 years, first it was cut by half in 2018, and last year only 9 of them got full inspections. We have to ask why that is, and we have to ask why it took the military going in and, you know, essentially whistleblowing on the conditions for any of us to really care or pay attention when workers on the ground have been saying similar things for many, many years. I mean, I was just scrolling through Twitter before this, and Les Perot of the Globe and Mail pointed out that in the Quebec context, dating back to the 90s, Journal du Québec and La Presse in the early 2000s had all sorts of really good investigative work looking at the conditions of, CHSLDs in the province of Quebec. And Françoise probably saw it, but Infoman did a very good compilation of various health ministers, throughout the years, all basically saying that, our resources are fine, everything's fine, when we all know now that that is not the case. So I think we really have to look at ourselves in the mirror as a society and say, is this really how we want to treat our elderly? Is this really what we're willing to accept? Because I would like to think that answer is no.
Yeah, I think you raise a really good point. And Françoise, I'm wondering what you think, and you had talked about this as well, why this isn't, I guess, why haven't we been more consumed with it in previous elections, let's say. I mean, Supriya's right. I also did, a quick search to figure out, okay, what's the history of this in Ontario beyond sort of the surface knowledge that I have. And I read articles in Post Media from 6 years ago about inspections being cut a few years after in Ontario. The then Liberal government promised to increase them. They were, just 84% of Ontario's 630 long-term care homes will get a full inspection once every 3 years. And then the point Supriya makes about only 9 out of 626 homes last year in Ontario receive one of these sort of random full inspections that are supposed to happen way more frequently. Why do you think there has not been the political will so far or the societal will to truly make a difference in these homes?
I think there's a bit of a kind of a blindfold collective situation that arose a few years back, and it dates from when we had deficit, and it was deficit zero, and governments were all into deficit zero. We don't spend on nothing. The big cuts from the federal, the big huge cut, 50% cut in the health transfer and social program transfers to the province. Province were trying to not hike the income tax on their respective territories because the federal was giving gifts left, right, and center. We've been on the economy, and I'm not saying it's wrong. I don't want to be killed by Stockwell and sound like a socialist, but I'm just saying that was the word of the day: economy, global. We're a market, international country, and so on and so forth. And meanwhile, we all forgot. I remember preparing election, and my team asking what's priorities. I always said health is number one. Health should always be number one. Go back to a lot of polls that were done by big polling firms throughout Canada during the past few elections. It was economy, environment. Those were the themes. It's as if we create themes of the day and we forget the essential, which is health, seniors, the most vulnerable in society, and doesn't mean that we cannot be a viable economically going country, but it means that we can leave those guys behind. And that's, I think, something that we all collectively lost a prospect of. And now we've been told years after years after years, but now we have to face the music. There's been lots of death because of our collective negligence.
Stockwell, what do you think on the question of political will?
I think the will is there now, certainly. One thing that I learned from days in provincial government where daycare centers were provincially administered and funded, we had in the government of those days an ongoing, call it a roving committee, partly made up of MLAs, who would go and visit, and it was in the act, daycare centers, public and private, and they would drop in unannounced, and they would have a checklist, and they would see just how things were going. And daycare centers, again, public or private, and really we've seen in daycare centers and in seniors' homes, there's some publicly run homes that are wonderful, and others that, I don't know if I'd want to stay in, and the same in the private sector. But you've got to have that almost daily vigilance, and you have to have centers knowing that the daily vigilance is there, as well as having an ongoing reporting system. So it's the immediacy, the ability for something to be reported right away, which you have to have in place where children, let's say, of the adult children of seniors who are in centers can make a call, almost like a whistleblower, and say, please look into this situation. But to have that ongoing team of people going around checking out centers, seeing what's going on, is a real incentive to good behavior and to good performance.
Supriya, a lot like so many issues in this pandemic, it's a tricky jurisdictional one, and I think it sort of changed the conversation, at least around jurisdiction and healthcare to a certain degree, or the kinds of questions that governments are getting on this. What do you think the potential role for the federal government is here?
Well, I think for what Dr. Philpott pointed out in terms of getting a national inquiry, because I don't think this is just a problem in Ontario or just in Quebec. But I think even the most pedantic of sticklers when it comes to sections 91 and 92 of the Constitution and the division of powers will agree that we need, perhaps either better cooperation, or this is one of those things where maybe it's only something that the feds can have oversight on. I'm not necessarily of that view. I think the provinces managed properly can probably come down to this, but it's definitely something that's not going to go away. And I think with the what the premier said today, basically saying that it's all well and good, but we need more cash. And to get more cash, we need the feds involved. Then the feds would be very wise to listen to what the premier had to say about that.
Françoise, what do you think the role of the federal government is here?
Well, coming from a province that is very into the Article 91 and 92 and 93 of the Constitution, I think Premier Ford was saying it exactly. I will expect the intervention of the federal government. I keep saying this because we tend to forget, but in the 1990s, when Jean Chrétien decided to bring a deficit zero through his Minister of Finance, Paul Martin, they really hurt all the provinces, and especially Ontario and Quebec. I'm not justifying the bad systems that exist in both provinces right now, or the shortcomings, I should say. Problem with a national inquiry is that they don't necessarily function under the same system under health. In Quebec, we've been through numerous modifications through one government to the other, from the PQ to the Liberal and now the CAQ. It's just to see how these changes through the years have impacted the system and the CHSLD versus what happened in Ontario and so on and so forth is going to be quite something. I think the provinces will have to do their job first and come up with demands at the end of the day that are supported by facts, by needs, serious needs, and sometimes just reallocating a certain resource from within a budget. It's just a question of priority. Let's face it, CHSLD, long-term care facilities were rarely a priority for most government because these people are not the strongest complaining voters, and it's sad to say, but that's a bit what we have right now. So I hope the Prime Minister, and it's sad at the same time that it's in the worst economic time of the federal government after all these years of being so doing so well, that the needs for health funding will be really upgraded to a level that we've rarely seen.
We spoke a few weeks ago to Gaetan Barrette, the former Quebec Health Minister, Stockwell, who said if you wanted to deliver health care in long-term care homes in Quebec to the degree or to the level that you have in hospitals, you'd need an extra $5 billion a year to do so. That was his assertion. Do you think the feds are going to have to pony up more cash, and do you expect there to be strings attached to that?
Well, just the thought of more money is something that we shouldn't push back against as long as it's being properly designated. But having the federal government administer almost anything in an area of provincial jurisdiction is a recipe for problems. The larger the government, the more cumbersome and lumbering it is. And you get all provinces having to get together about ways that the government is or isn't, the federal government is or isn't doing things. So I would tend more to François' position on this. It's a provincial jurisdiction. Hold those provinces to account. And as you know, with the numbers that just came out about the federal budget, the deficit is skyrocketing to such a degree now. The interest payments alone are going to be $22 billion. That's money that could go to things like provinces, but let provinces be the decider in terms of their healthcare systems where the needs are greatest. And that's the way it should be. I'll tell you, this whole thing that's quite rightly and properly, but sadly, come under the public conscience now. I think this is going to move this area. Seniors' homes and care of seniors is increasingly going to be a political area of a political hotbed and political focus, and it should be.
Do you think that's true, Supriya? Do you think, and I ask only because it certainly seems like we're seized with it right now, but there have been, previous inquiries, there was SARS, there were other incidents that shone a light, I guess, on the situation in there, maybe not to the degree that we are seeing right now. What's your level of faith that this actually changes things?
I mean, we have to have some sort of optimism here, right? That we've actually reached a collective tipping point and have said that that's it, that's enough. I share Stockwell's optimism that hopefully this turns into a situation where there's, political will behind this. I worry, though, that here in Ontario in particular, it'll get, bogged down with a lot of partisan sniping of, oh, it's your fault or it's your fault more. I mean, it's everyone's fault. Let's just accept it. It doesn't really matter at this point, which party is to blame the most, because we're all to blame at least a little. And ultimately, we need to fix it going forward, and pointing fingers and saying, like, the buck stops here, but also, it's the system I inherited. That's like apologizing and saying, oh, I'm sorry you're upset. That's not really an apology. And I think we need to, be adults about this and realize that we have, undercut and shortchanged our seniors in this country. And, it's disgusting. I do encourage all of the viewers to read the report and to read exactly what the military had to say, because to see it in print like that was quite galling.
It's hard to read, but it's important to read as well. Thank you, guys. Thanks so much to all three of you, Stockwell Day, Supriya Dwivedi, and Françoise Boivin. Prime Minister Justin Trudeau earlier said today that the federal government will, quote, be there for Ontario. We did ask to speak to someone from the federal government about what exactly that means, but no one was made available. We have, however, reached Jagmeet Singh. He's the leader of the NDP. He joins us in Ottawa here. Hi, Mr. Singh. Good to see you again.
Good to see you, Vashi.
So I have to start off asking you for your reaction. Like so many of us, you were among those reading the report today. What did you feel? What was your reaction as you read it?
I was horrified, just horrified at the level of neglect and behavior which the military indicated verged on abuse of elders, of seniors, people who are vulnerable, people who have spent their whole lives. And I asked the Prime Minister today because I think that compassion for what's going on is simply not enough. Naturally, we feel compassion for our seniors, but we need action immediately. And to my questions, I said at this point, it's got to be clear, given the horrid conditions, particularly the worst conditions being in the for-profit long-term care homes, that this has to be the moment where the federal government takes some leadership and says, we must work to remove all profit from the care of seniors. And to that question, the Prime Minister cited jurisdiction. I don't think this is a time to talk about jurisdiction. This is a time to have the commitment to do something about the horrible conditions that seniors are living in.
My guess is, though, and I take your point around that, we've had a lot of people talk about the nature of profit in this arena, certainly. But if the Prime Minister were to say, hey, Ontario, you can no longer have a for-profit home at this moment, there would be a lot of pushback. In fact, if he said it to Quebec, there would be a similar response. Does the jurisdictional argument not carry some weight practically?
The practicality of it aside, it's the value statement. The Prime Minister just has to say, yes, we should take some leadership. Like, I can't accept if the military, our Canadian forces, went into long-term care, both in Ontario and in Quebec, that the federal government can't say, you know what, we've got to take some national leadership and say, these are some of the things that we see as problems. Let's take a step to say we want a national care guarantee. Let's look at what the worst conditions were and start talking about solutions and start putting those solutions in place. I just don't want to see a Prime Minister get caught up in discussions about jurisdiction when we have seniors dying. Like, we can work through the jurisdiction. We can work through the Constitution, but we need a commitment to do something. I just don't want to see people throw their hands up and say, oh, it's not in my jurisdiction. I don't want to do anything about it. We've got seniors dying, and it's outrageous. And that's why, to me, the Prime Minister's response of just citing jurisdiction is a cop-out. Like, these are seniors dying. We need, and not just dying in horrible conditions. We have to say, yes, we're willing to take a stance, a national leadership role, to not just ask for help, but say, let's get these provinces together and start working out the solutions.
We had Jane Philpott, former federal health minister, on just a bit earlier on the show. And Dr. Philpott was talking about the possibility of increased, for example, funding from the federal government, something that Doug Ford has signaled the province needs, and the possibility of, for example, attaching strings to that. So attaching, standards that have to be met that aren't just guidelines. Is that something that you would support?
Absolutely. We called on that right away, that we have a model that we can follow. The Canada Health Act lays out the broad principles that we all hold very dear around our healthcare system, and that healthcare transfers are based on those principles of universality, of publicly delivered care, making sure that care is transparent and transportable and accessible. Similarly, we need to apply those same principles from the Canada Health Act, those same broad principles, to healthcare transfers when it comes to long-term care, and to roll that into a national vision around the standards that we all agree upon that would require working with provinces, but taking a leadership role, and say, with that leadership role, we can develop those type of care guarantees and then put forward funding based on those strong accountability measures.
Is that different than these homes now being moved under that act and being under federal jurisdiction? Like, are you arguing for something different than that?
No, I think that what the health minister, the previous health minister, Ms. Philpott, what she suggested is exactly on point. The idea of, I think we should absolutely remove for-profit, though, from receiving public funding. It should be not-for-profit or publicly delivered care. We've seen billions of dollars in some of the worst for-profit centers go back to shareholders, billions of dollars that could have been reinvested in adequate protective equipment, adequate staffing levels. These are some of the concerns that the military pointed out, that staff were afraid to use protective equipment because of the cost of that equipment. That should not be a factor when it comes to the care of seniors. And it is a factor if profit is your motive, then you're going to look to saving costs and cutting corners. And in the case of seniors, cutting corners could mean lives being lost.
We know in public delivery, the public delivery of healthcare, it's not necessarily a guarantee that everything works really well either, right? I take your point on again, some of the concerns around profit being a motive at all in any of this. And certainly some of the stuff in this report that highlights that is jarring and difficult to read. But even in hospital settings, right, the delivery of healthcare isn't necessarily a great or perfect experience for everyone. So I guess I'm challenging the idea that just changing the for-profit model will immediately rectify or permanently rectify the damage that's being done, the problems that exist right now.
I think you're absolutely right in the sense that we need to go beyond that. But I would push back and say immediately removing profit would immediately increase the amount of dollars that go to care, that go towards the care of seniors. So it would immediately improve the situation, but it wouldn't make it perfect. Our healthcare has been starving from funding because of cuts based on subsequent Liberal and Conservative governments who have decided to cut the federal transfers, which used to be 50-50 when it was first put in place. And now the transfers are more like 20% federal, 80% provincial, which means almost half of the funding that provinces relied on has eroded over time because of those decisions made. And I think you're absolutely right. We need to increase funding, not decrease funding, between the federal government and the provincial government, which is absolutely in our jurisdiction. But the removal of the for-profit model will certainly immediately increase care, but it's not enough. We also need to increase funding, and I agree with that assertion.
And just before I let you go, Mr. Singh, I wanted to get your take on the idea of an inquiry. I know there are demands for one at the provincial level. Do you think there needs to be some sort of independent inquiry federally?
We need to, I think, move toward action, and however we can get the evidence. We've got some reports right now that point out the flaws in the for-profit model, that point out the flaws in the worry that staff had about protective equipment. So let's start implementing some of those standards. I'd like to see us move towards building a national standard based on the provinces and working with provinces and territories, and then commitments to increase funding based on the values of the Canada Health Act, and then making sure that we deliver better care for seniors. I'd like to see some action, but I'm open to the fact finding that might be necessary to get to the point of making some of those decisions. But some of them, we can say right now what we need to do, and we should start working on them immediately.
Okay, I'll leave it there. Mr. Singh, thanks very much for your time this evening. Really appreciate it.
Of course, thank you.
That's NDP leader Jagmeet Singh. I just want to bring you some breaking news on this story via my colleague Phil Ling. There's a statement from the Canadian Armed Forces. I want to read part of it to you. As is the case for any deployed operation, be it domestically or internationally, Canadian Armed Forces members have an obligation to report their observations as they pertain to the mission. It is in this context that CAF personnel on Operation Laser supporting long-term care facilities document and report any observation that could be detrimental to LTCF occupants, their employees, and to the mission. This, of course, speaks to the question of how all of this came about, why these observations or how these observations were passed on to the government. So the intent of reporting these observations, DND goes on to say, is to provide constructive situational awareness to the chain of command and report on any possible issue that might hinder mission success or, more importantly, bring harm to those we serve. As such, in the course of their duties in Ontario LTCFs, the team observed and documented a number of issues relating to the provision of care to residents. Of course, that's what we've been reporting on all evening. That report was delivered to the federal government, which then in turn delivered it to the provincial government. All governments are promising action. Those specifics on exactly what action will be taken are hard to come by.
But it's unacceptable. You know, I think it's appalling. I think it's disgusting what has happened. Just the dignity of these patients in long-term care not being cleaned. These are just standard operating procedures to clean someone. When you feed them, you lift them up. I'm not an expert in health, but I know when you feed someone, you lift them up and feed them. It's so disturbing when I read this. It was hard to get through. It was the worst report, most heart-wrenching report I have ever read in my entire life.
Issues with long-term care is something Brampton Mayor Patrick Brown has become personally familiar with. His 105-year-old grandmother, Teresa Brown, has lived in Meehan Manor for 7 years. It's not one of the homes where CAF members are deployed. However, when his family couldn't get information on how she was doing, they placed a tablet in her room to monitor her around the clock. Brampton is, though, the home of Grace Manor, one of the facilities outlined in this report. Mayor Brown joins us from that city now. Hi, Mayor. Good to see you. Thanks for your time again today.
My pleasure.
So let me ask you for your initial reaction to this report, not only as mayor of the city, but also someone whose own grandmother is in one of those long-term care homes. As we said, though, not one of the ones the military is talking about.
Well, for the home in Brampton, it's harrowing. Reading the report saying that they were using the same PPE throughout the home, not changing it when they were with negative and positive residents. No wonder the virus was spreading so quickly. Reading the report where it said that they left food in residents' mouths while they were trying to go to sleep, it just incredibly disturbing. On a personal level, I'm not surprised because I saw the negligence in the treatment of my own grandmother. But by the way, she's 106. She turned 106 last week.
I'm sorry.
Yeah. So on a personal level, seeing how she was treated and seeing the ongoing challenges they have with issues like PPE, I think this report is important because it shines a light on what has been a very disturbing aspect of this pandemic. And I really think that as a country, we're going to be judged very negatively on how we took care of our older generation.
How's your grandmother doing right now?
She's resilient. She's doing well. But it's not easy. I tell my grandmother each day on the camera that you've lived through the Spanish influenza, the First World War, the Second World War, and you can make it through this as well. But it's tough on all of them.
How frustrating is it? And this is something I've heard from a number of family members who have loved ones in these homes, and I'm wondering where you sit on it. There is a restriction, of course, on going to visit them right now because of COVID-19, but it's also led to a lot of family members feeling like they don't have the information that they need. They're frustrated to read what they read today and not be able to do something about it themselves. Do you think there should be a conversation about I don't know if relaxing is the right word, but sort of amending those restrictions to reflect the need to be able to see how your loved one is actually doing?
Well, I think every family that can get a camera in to the home, that's a huge benefit. I know that it made a difference for my family getting a camera into my grandmother's room. You know, one thing I spoke to the Premier about today that I'd love to see is a whistleblower system, because you get one spin from the management of these homes that everything is fine and they're managing it. And then you speak to the caregivers who will speak more candidly with you about the real problems. The families will tell you the real problems. And so, you know, we really need to make sure that the truth gets out. And I think this report got the truth out on 5 homes, but there was over 150 homes in Ontario that were in outbreaks. And so this is only the tip of the iceberg of the problems that we've had.
And was the Premier receptive to that?
Yeah, very much so. His wife, Carla, because of her mother, is very passionate about this as well.
Do you think there needs to be, I mean, you're aware, I'm sure, as everyone else, there's this huge political discussion right now about what needs to happen immediately and more so in the long term. What are your feelings on an inquiry, for example, being conducted? Like what sort of accountability, maybe putting aside your politics, but just as your experience with your grandmother, what kind of accountability do you want to see?
Well, there needs to be accountability, but you know, that's sort of stage 2. I think stage 1 is managing the pandemic, because we're still losing senior citizens. We're still losing people every day in these long-term care facilities. But down the road, would I like to see accountability? Absolutely. And I hope the people running these homes know that if they are choosing their financial position over the health of residents, there'll be consequences for that. You know, you hear these stories about people choosing not to get extra PPE or choosing not to get extra staffing because of financial considerations. And I do hope down the road, for people that have made selfish decisions, that there will be consequences for that.
In these homes, maybe even prior to down the road, you know, especially the 5 that are focused on in this report, we spoke to someone whose mom is in one of them, for example, and she, you know, she's understanding of the stuff that needs to happen down the road, but she's really worried about the immediacy, right? She's worried about what's happening right now. Is there a role for the province or the federal government, I don't know who, in sort of stepping in right now in those homes? Like, do you think more needs to be done in that respect?
100%. I know in Brampton, we were fortunate that we've got a close relationship with the hospital and the long-term care homes. And so some of the more serious residents affected by COVID-19 actually got transferred to the hospital. But you'll see in some of the health districts, like the one that my grandmother is in Toronto, there's not that same linkage with the hospitals. I think more immediately, I would love to see the hospital linked to some of these long-term care settings to make sure we're getting proper care and oversight.
I just wanted to, before I let you go, ask you about another subject that we discussed, I think it was just last week, and that is the reopening of the economy in Ontario and some of the more troubling testing results that everyone was seeing in the GTA in particular. The Premier said, I think a few days ago, that he had talked to you about expanding the criteria for testing and the potential impact of that. Where do things sit? How comfortable are you with the level of testing done right now and the speed at which the economy is reopening?
So we are nowhere near being ready to reopen in Peel region. We still have community spread. And so when I hear other municipalities talk about opening up sectors of the economy or baseball diamonds and basketball courts, my immediate reaction is that is incredibly premature. The virus is still spreading at a rapid pace in the GTA. In terms of testing, the last 2 days, we've tested more people at our assessment center than we have at any other day during the pandemic. And so I'm pleased with the direction this is going. I believe to accurately track and trace the virus, you have to have broad-based aggressive testing. Just yesterday, I asked all city staff in collaboration with our labor partners, the local city unions, to test all city employees. And I'm encouraging everyone who's gone back to work in a retail sector in Brampton to also get tested. And
are you confident they'll be able to?
So far, it's been a really positive response. Like I said, all 3 major unions in the city supported the request. And as long as the capacity is there, and that's the big question, I think this will make a significant difference.
Okay, I'll leave it there. Thanks, Mayor Brown. Appreciate your time as always.
My pleasure.
Patrick Brown is the mayor of Brampton in Ontario. We, of course, wanted to speak to more family members about their reaction to the report we were discussing, the report from the Canadian Armed Forces into the 5 homes that they were working in Ontario. June Morrison's father, George, was a resident at the Orchard Villa home in Pickering, one of those 5 homes where the military was deployed. She contacted the coroner the day after her father passed away on May 3rd. His death is now being investigated by the Chief Coroner's Office. I spoke to her earlier today and asked her what her immediate reaction was to hearing the details of today's report.
Shocked but not shocked, because we already knew a lot of the information that came to us. I am ever so grateful that somebody had the courage to write what they actually saw and escalate it, and the timing be today. To know that my father was starved, to know that people were choked on food and died in their beds because they weren't elevated. Food was shoved into their mouths. They were expected to eat food and they actually choked on it. That is heartbreaking to hear that. To hear, like, we already knew Dad wasn't clean. He had a UTI. So to know that people lay in their diapers, their urine with feces for a whole day or longer than a day, they hadn't been bathed. They hadn't had anybody nurture them or let them know that they were loved and cared for. It was just, to see and to hear what I've seen and heard today is very upsetting, but I'm glad it's finally come forth, because if anybody's been listening to Kathy Parks and I, we've been going on for weeks now talking about what we knew that was going on inside, and it's like falling on deaf ears as it relates to the politicians. Nobody listening to us requesting a meeting and not getting a meeting and getting a cookie cutter kind of response to say, grievances, condolences, sorry, basically move on with your life is kind of the message that we've got.
So for
today,
politicians, for politicians watching right now who are, going to be tasked with addressing exactly what these military members have laid out, what is your message to them? What do you want to see the government do?
First off, I'm going to say to Minister Fullerton, respectfully, you've let us down. You've let my father down. You've let many people down, and I think you need to step up, and this need for a public inquiry is adamant. It needs to happen now. Your house closes on June 5. You have to do something this week, as in tomorrow, if not tonight. You need to take control of this home. So we need the public inquiry. We've already reached out to the local police asking for a police inspection, as in a police investigation. We think that this military response today will certainly light a fire and make that happen. But we need all this to happen now. We need the management and the administration removed from this facility immediately. We need other hospital staff who are dependable, who are trustworthy, who actually do care about people to come in here. Because if you've heard about the abuse, the neglect, and other that's happening, that has to stop and stop now. There are many families that still have loved ones in here. To think that there's cockroaches running around, there's mice running around. Somebody wrote a note today, there's a mice on their mother's bed. This means this place is filthy. This place should be closed. As far as the long-term care home aspect of it, it needs to be closed immediately. The management need to be taken out. The records, we know that we were told through a letter to Kathy that the records were being redacted. Redacted, history changed in essence. The longer that's allowed, we're not going to get to the truth of what really went on in here. So I have a strong message for Minister Fullerton. You have to act and act now. No more sitting on this. No more sleeping on this. My dad lost his life. You might say 77 people's lives were lost. Lives could have been saved if somebody acted up 3 weeks ago, 4 weeks ago when we raised this to media and other attention. Lives have been lost, and there's going to be more lives lost. They have to step up. They have to do it now. Public inquiry, definitely. It's a now. Police investigation, it's a now. Get rid of all the management and the admin now.
And get the real stories. Get the real stories. Get the truth. Get justice for everybody who lost their life and everybody who's been tortured by just being here and removed from their families. Please do the right thing. Please do it now.
Okay, June, I want to thank you so much for sharing your time with us and your story as well. My condolences once again about your dad.
Thank you.
Thank you very much. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.